Hello, my dear friends. I am Dr. Charles, and this video is about how we are preparing for our health facility inspection. Government regulators conduct these inspections to ensure that hospitals and clinics meet the standards for safe, quality, and professional patient care. Let's get started with our preparation for the upcoming inspection.
This is a clinic inspection simulation. We have a reception area and a waiting area and one wheelchair in the waiting area. We have a fire extinguisher. We have patient rights and responsibilities. We have an evacuation plan. We have stickers to educate patients. We have PPE in the waiting area, education, the TV for education, fire action plan, and a medication room, which is always locked, and a medication cabinet. The medication is neatly arranged. It's always under lock. You have the medication SOP, and the medication prescribing and referral protocol. We have a fridge with a thermometer, a functioning thermometer. We document the drugs in here in a booklet. We have directional signs indicating where patients should go. Patient education material, privacy screen, 2 washrooms, sink, sanitizer, soap dispenser, instructions for washing the hands, PPE, infectious waste bin, and a clean toilet. We also have a sluice room with gowns, PPE, instructions for diluting chlorine solution, how to wear the PPEs, a functioning sluice tap, sink, infectious waste bin, and floor directions indicating the flow in the sluice room. We also have a registration desk, a triage room, a triage chair, a chair for patients, a stadiometer, a weighing scale, another weighing scale, bedside cabinet, BP machine, temperature thermometer, pulse oximeter, a washroom, supplies cabinet, washing sink, infectious waste bin. That leads into the consultation room, where we have patient chairs, cabinet for supplies, patient monitor, a desk, scan, a computer, a TV for showing the patient what they are being seen for, microscope, PPE, patella hammer, tuning fork, and a pen torch that works. We have a fire extinguisher here, infectious waste bin, general waste, examination couch, shelves box, fridge, sink, flowing water, X-ray viewing machine, hand washing technique instructions, dispensers. We also have a resuscitation room or accident and emergency, infectious waste bin, suction machine, a defibrillator, oxygen cylinders, patient bedside monitor, bedside cabinet, a bed with overbed table, medications including hydralazine, atropine, furosemide, naloxone, lidocaine, paracetamol infusion, Ventolin, labetalol, nitroglycerin, Ringer's lactate, PPE, first aid kit, ambu bag, intubation kit, stethoscope, sink, instructions for washing hands, soap dispensers, infusion stand, oxygen cylinders. We also have a sterilizing room. Instructions for how to boil the water, hand washing technique, sterilizer, infectious disease bin. We have a laboratory area with laboratory supplies, PPE, shelves box, hand sanitizer, liquid soap, hand washing technique, a sink, with flowing water, a cabinet with test types. We only do ELISA test types, and the documentation for the various test types are here. Then we have a clock for timing the tests. We have a long corridor with a stretcher and a nurse's station close to the wards. The nurse's station has protocols on the wall to educate the nurse. We have a laptop computer for the nurse to work with. This is the male ward with privacy curtains, bed, bedside cabinet, infusion stand, overbed table, infectious waste bin, non-infectious waste bin, a clean washroom with a shower and a toilet, another bed with bedside cabinet, supplies cabinet, sink, fire extinguisher. We have a changing room for the staff, table, chairs, educational material on incident response and documentation, fall prevention, patient safety, discharge clinical care protocol, immediate response and post-exposure prophylaxis management, washroom for the staff, lockers for the staff. We also have a dressing area or treatment room, sink, hand washing techniques, soap dispenser, general waste, infectious waste, PPE, cotton, gauze, dress, Savlon, needles, cannulas, syringes, giving sets. stadiometer, weighing scale, BP machine, supplies cabinet, and 8 different types of SOP books for documenting meetings, documenting procedures, and standards. We also keep registers as required by the Ghana Health Service. So we have monthly outpatient morbidity returns, which we send to the district. We have monthly malaria data returns on anti-malarials and consulting room registered. We also have administrative tools that are used to administer the clinic. We have protocols, various clinic protocols and policies. We have mobile phone usage protocol, electric gadget protocol, non-clinical staff SOP protocol, incident protocol, needle injury, laundry protocol, general cleaning protocol, fall prevention protocol, resuscitation protocol. We have 41 of such protocols, including infection and incident control, testing protocols, prescription management protocols, admission and detaining protocol, emergency resuscitation protocol, cleaning and waste management protocol, laboratory specimen handling protocol, outbreak management protocol, cold chain management protocol, mental health and crisis protocol. So we basically have protocols for everything, which we periodically update. We also have incident report tool where anything that happens that occurs outside of the ordinary is recorded. And then we also have staff records where we keep the records of the staff. And then we have training as well, where we list the training that we have given to our staff. We have job descriptions for our various staff. We have an organogram. We have clinic licenses, legal documents, financial records, cleaning logs, equipment management, inventory, fire safety, waste management, cold chain management, emergency contacts, meeting minutes. Apart from keeping the soft copies of the various protocols, we also have hard copies here. So this is the occupational logbook, instruments and equipment logbook, waste and PPE protocols, building maintenance book, waste tracking logbook, fire book, dangerous drug book, accident and injury book, adverse drug reaction book. Even though we don't have a fully functional pharmacy, we still signed up with a pharmacist to assist us in making sure that we are consistent, and we also are in compliance with the regulations. We also have certificate of registration from the Registrar General, the district registration for our center, then Ghana government EPA, as well as the organogram, a hard copy.
We also keep in a highly visible area the vision statement, the mission statement, fire certificate, and HEFRA license.
Apart from keeping the soft copies of the professional staff, we also keep hard copies. So this is the Medical and Dental Council license for the practitioner in charge. We also have nurses, registered nurse and midwife certificate for the midwife and nurse. We have their pins, the pin of the second nurse, and the certificates. We do a HEFRA mock inspection every so often. where we go through the compliance checklist to make sure that our clinic is in compliance. Some of the questions we ask ourselves is the practitioner in charge has 5-year post-qualification experience? Are there at least 2 professional nurses? Copies of the current practicing licenses and certificates, are they available on site? Minor ailment treatment, primary health care services, health promotion and preventive services, non-invasive services, minor surgical procedures, maternal and child health services, short and long-term family planning, any immunization or child care programs, dispensary services, basic laboratory services. We check to see if we have the appropriate things at the information desk, the waiting area that's at least 4 by 3 meters, triage area, nurse's room, consulting room, treatment room, observation ward, medical records, dispensary and pharmacy area, washable floors, clean patient toilets, adequate water supply, constant electricity with alternative power backing, and equipment, sterilizer, dressing trolleys, emergency trays, suture kits, resuscitative equipment, wheelchairs, written procedures for transport and disposal of used medical material, hand washing facilities, separate ward for males, females, and children, beds with screens, drip stands, bedside lockers over bed tables, clean bathroom and toilet facilities, roof and walls intact, non-slip floors, emergency evacuation diagrams, pedal-operated dustbins, hand washing technique posters, shelf disposal available, protocols, exit doors clearly marked, fire equipment with inspection in less than 6 months, chemicals stored appropriately, pest control, preventive maintenance for building and fixtures, fire drills, facility equipment records, waste tracking logbook, occupational logbooks, and emergency equipment. We do this periodically to make sure that we stay in compliance.